noon. We're going to get started. Good morning, good afternoon, everyone, wherever you are. Thank you for joining us for today's webinar on the importance of Indigenous birth and breastfeeding. Today we have Hope Mayotte from Indigenous Birth Services with us to discuss the importance here today. My name is Misha Leffler, and I'm the Cancer Equity Coordinator here at the American Indian Cancer Foundation, and I will be the host or running things in the background a little bit today. So a little background on the American Indian Cancer Foundation. The American Indian Cancer Foundation is a national nonprofit organization established to address the tremendous cancer inequities faced by American Indians and Alaska Natives today. Our mission is to eliminate cancer burdens on American Indian and Alaska Native people through education, improve access to prevention, early detection, and treatment and survivor support. So this month, we are really excited to be celebrating our Indigenous Milk Is Medicine campaign awareness month. And so throughout August, we recognize National Breastfeeding Awareness Month. And especially this week, we are taking a look at Native Breastfeeding Week. So that goes from the 9th through the 15th of August, and we are honoring the sacred birthing people who give life to our sacred youth. So this nationwide initiative raises awareness about mothers and birthing people's milk and its medicinal powers that support the health of our babies and birthing people. And today, as I said, we have the importance of Indigenous birth and breastfeeding with Hope. I will let her introduce herself a little bit. And I do just want to let you guys know that our objectives for today are to discuss the traditional birth and breastfeeding teachings and then highlight the importance of supporting culturally appropriate care. Yeah, so I will let Hope take over now.
Okay, thank you.
And then kind of as she gets set up, just so you know, we are recording this today, so it will be available online. If you have any questions, please feel free to drop them into the chat. If you use the Q&A, I might not see them, so the chat is preferable. Yeah, we're excited to have you all today. So, yep, all yours.
Okay, can you see my screen?
I cannot, but I'll stop sharing mine.
Okay, let's see.
No, I can't see your screen.
Okay. Let's see. Try this again. Okay. Okay.
There we go.
Okay. So the name of my Indigenous Birth Services is Wiji Nata Wigana Wasoje, and it means the one who help each other bear children. My name is Hope Mayotte. I am an Indigenous midwife student and an Indigenous breastfeeding counselor. So about myself, I was born and raised on Bedouin Reservation, which is located on the shores of Lake Superior. I am a mother of 6 children with all different unique birth and breastfeeding stories. I've been an advocate for breastfeeding for almost 9 years and midwifery for 7 years. I'm currently attending Midwife's College of Utah, and I'm enrolled in the Bachelor's of Science in Midwifery program. And I recently started my birth services to better serve the tribal communities in our area. I work with the Ashland Birth Center. I collaborate with them. And some pictures of my family, and on the right you'll see we have my birth lodge that I built. All of my births have ranged from hospital, out of hospital, home births, and lodge birth, and then an unintentional, unassisted birth with my last. So the services that I offer, I go by the Minobama Ziwin, which is the good life. I incorporate the 7 grandfather teachings into everyday life. It's really something that is important to me and in our culture. So I like to focus on that with anything that we do every day. I use traditional medicines, sage, cedar, sweetgrass, and tobacco, and you're free to use that whenever you would like and while receiving services. I help women and people with ribbon skirts, moccasins, moss bags, the Dickinogin, and the Indian swing. Some of the things that we will help assist with at the birth is the birth fire, birth lodge, and then after the placenta ceremony, we'll discuss that. Meeting Mother Earth is another ceremony that we do. It's it's meeting Mother Earth first. So when baby's born, the first thing you would do is have baby touch the ground just to meet Mother Earth and start out in a good way. Also stories and songs. We do that with births here whenever that you would need it. Indigenous breastfeeding support. I've been doing that for a long time, and it's I've opened the door to really anybody in the community if they have any questions. It's really about being that person that somebody needs, because in order for it to be successful, they need support. And I'll discuss more about that in the next slides. But I also do traditional herbal remedies, usually cedar tea. We'll do ginger packs for the perineum and other things. So a big thing that I like to discuss is be your own advocate. Take back your voice and your power. It is your body, your baby, and you can say no. A lot of people do not know that you have the right to say no to anything. They should be asking for permission to touch you, touch your body, your baby, anything they should be asking. So to find a provider who supports your wishes and will give you some power and your voice back. That's really important. So culture is prevention and healing. We know that our communities are trying to reclaim our culture, which would include Indigenous birth teachings, traditional parenting, food sovereignty, breastfeeding, and community care. So why should you support Indigenous birth workers? Indigenous midwifery incorporates ancestral teachings to bring hope, sense of belonging, and pride in our identity as Indigenous people. Indigenous midwives have a deep understanding of the needs of the families and community we serve. Indigenous birth services help reclaim sovereignty through ancestral teachings, practices, and ceremonies. Indigenous midwives offer culturally informed holistic care that reduce barriers, disparities, and trauma that Indigenous people face due to colonization and discrimination. We offer unique holistic care that emphasizes on the importance of relationships, balance, and ceremony. So, oops. I Noonie. It was a cute little saying that we came up for a baby t-shirt since it was all technology nowadays. Breastfeeding is food sovereignty. It is their first food, their first medicine, and it heals communities. Every drop of breast milk is healing trauma. Breast milk is the most secure and sovereign food source we can offer our children. And encouraging and supporting the golden hour, the first hour, is crucial. Keeping the baby and parent, the birthing parent and baby connected just for that first hour so they can bond and heal from when we had our children, you know, the historical trauma of that, our children being taken from us and we lost the connection. And that is crucial with that first hour to bond and to make sure that they nurse within that first hour, and the support is crucial for the success. So if you know they face barriers and they do not have the family support, be their support or find the support they need. If they do not have the support, it will be hard to continue. And the longer, the more benefits there are for baby and mom. So going into the benefits, it's free. Where we suffer from poverty, really high poverty rates, and this is on demand and it's free, and you don't have to worry about the decline like we've seen with you know, the pandemic. We had moms that were struggling to find formula because people were stockpiling, and not only that, then you're risking going into the store. So that's really crucial at this time, especially during a pandemic, and you really don't know what could happen. It decreases the risk for breast and ovarian cancers. It also lowers the risk for type 2 diabetes and postpartum depression. It burns calories, helps your uterus return to normal size. Of course, it's environmental friendly and there's no waste or pollution. And it saves time. As a busy mom, I absolutely love that. It saves time. I don't have to worry about washing stuff out, bottles. It's just, you're just connecting and you can have siblings helping out. And so benefits for baby, it reduces risk of developing type 2 diabetes. It also lowers their risk for cancer as an adult. So this is really setting their first, setting them off right in life and making sure that they're healthy for the long run. There's fewer health concerns. It gives baby the antibodies they need, and it's easy to digest. The skin to skin with breastfeeding releases the oxytocin, and it makes baby feel safe and calm. So the historical trauma can be felt up to 7 generations. And as I was saying before, with the boarding schools, we lost the connection with their children, and we're trying to get that back, and it's really hard. That's why we have a lot of families that are working with Indian child welfare, and they don't know how to deal with it because it's trauma on top of trauma. So you have a mom that just, gave birth to a baby, and there's all these things, there's on the wrong focus on connecting with their baby, and it just ripples down there. So you really want to make sure that in their care, their prenatal care and their birth, it's really focusing on, that time that they have to heal and not create more trauma. And also one thing that I always like to include is the importance of fathers. Our men in our communities are really important. They, are keepers of the fire, and they do a lot of the legwork for our communities. They should help with the Dickinogin, the cradle board. Another thing is that birth fire. They start that birth fire and put their tobacco in and prayers for the delivery of their baby. Make sure their baby spirit has a safe journey and everything goes okay. So that's a huge role for the fathers, and it's really important for them to know that how important they are. Another thing is they help build the lodges. It's mutual work between the women and the men that build it together, but it's really about getting them involved, and they offer the physical and emotional support. And the importance of that is children learn from their fathers. They can teach their children how to live by the 7th generation, the grandfather teachings, how to be brave, how to be independent, how to have self-control, and how to listen and follow rules. They are important in our lives, and we need to make them feel like they are. The men have always stayed busy and had big roles in their family and their community. So when they lose their roles and they don't see their worth, that's when they fall down the wrong path, and that's why we'll see families with, one parent or stuff doesn't work out. It's all about making sure we support the culture and making sure they know their worth in our communities. Another thing is the family, community, and elder support. So Native Americans are about community. We seek our guidance from and honor our elders and leaders. So as somebody who is working with Native Americans, you need to respect their silence and allow them time to answer. They might not answer right away because they're going to go back and they're going to ask their elders or the leader in their family, who they look up to. They're going to ask them for guidance and see if it's something that they should do. So always make sure to respect the silence and allow them time. So how can you help? First and foremost, to know it is not your experience, it is theirs. It is the ceremony that they are doing, bringing baby to earth. It's very spiritual, it's very sacred, and it is a ceremony, and you need to respect it. So including the family and partners and children that are involved is huge. It's not about just the birthing individual and the provider. It's about the family as a whole. With Native Americans, we are very close with family members and our community. So another thing, asking for permission. Give the client their voice back and independence back. Encourage questions. And if you cannot best support them, find someone who can. It's not about, oh, I can do it all for them. No, everyone's human and you can't really suit everybody. So find somebody who can. And support the community-based support. So one thing that I'll say is invest your time, go into the communities. We have providers that will say that they are there for the community, whatever they need, but they actually do not go and learn about the community. Learn about your communities around in your area and attend the events. Make sure you're at the health events, the family services, and get out there and build the trust. You have to build the relationship and build the trust. And really, that's where it comes in, is that they see you put it in the effort to learn and actually show that you care. That's how you build the great relationships. And this is one of my favorite pictures that I shared. Bear with me, I'm trying to get this going here. So I don't know if there's any questions. I'm not sure if there's a chat, but yeah, one of my biggest things is just making sure that you get to know the communities in your area. Different tribal communities have different things that they do. So reach out, do research, and then get involved in the community. That's one of my biggest things to help support families as a whole and really be there. Also, my elder that I go to, Penny Charette, she was not able to be on here, but I wanted to acknowledge her that she is one that I look up to and that I go to for any questions that I have or support and birth work. And she has the right as our elder to, not have to go through the schooling or anything. She just is known as our Indigenous midwife. She earned it by life experience. So I wanted to acknowledge her during this time. Oh,
Unmute, yes. So now we can open up to questions from the audience, of course. I will kind of start. I really love the idea of breastfeeding and birth as ceremony. So I'm kind of curious, can you kind of expand on that a little bit? And we talked a little bit maybe about cultural traditions, but I guess what are some of those more specifically? And then how do you, I guess, with your own kids interact with breastfeeding as ceremony?
So we really, just from them being involved in the pregnancy, getting them involved and making them, know this is natural and this is what our bodies do. They know that it is a sacred time and they really respect it. It's really just getting them involved, really. Just not really, let me just say, I noticed some people would be kind of standoffish with like the using covers and stuff, but children are very, smart and they learn really easily. So just telling them, this is just sacred time to feed baby and the good things that come from it. So it's really just getting them involved from the very beginning. And just that first hour is really crucial, what I always talk about, just because that's the initial bonding with baby, and that really sets the path on how your breastfeeding journey is going to be. So if there's a lot of trauma in the beginning, people grabbing baby, moving all around, doing stuff to mom, bright lights, lots of noise, so a lot of less lights, bright lights, calm tones, and not really eliminate much chaos as you can. And that really helps, especially as us, as Native Americans, with the trauma, you don't want to build the trauma on top of trauma. And speaking on the baby in utero, that they're in the spirit world. So as a birthing a parent, you're carrying a baby that is in the spirit world. So you're standing in two worlds while you're in the physical world, and baby is in the spirit world. It's really, really sacred, and it needs to be respected because of that. And then when baby is born, that's why the birth fires is for the, it's like the beacon for baby spirit. It's not, we use birth fires for any ceremony. And so specifically it's for baby spirit, to make sure baby travels well and everything goes good. And you put your prayers into that fire, and everyone will kind of gather. And my elder Penny, she's really awesome about it. She'll tell all the family members, go around and say, take your tobacco, go to the fire and talk to that baby, talk to the spirit. And we had families that still did a birth fire even in the hospital. And there's ways to incorporate it even if you're not in the out of hospital setting. And same with meeting Mother Earth. We've done that where families have brought in the dirt from their homeland in a little bowl, and they brought it in, and they had them meet the Mother Earth in the hospital. So there is ways to incorporate it even if you are doing a hospital birth. So it's just finding out what your cultural teachings are in your community and seeing how you can incorporate that. It really makes a difference for your experience and baby's experience as well.
That's really beautiful. I am really curious about how you got kind of interested in birth work, but then also maybe even like way before that, like when you were younger, what was your experience with birth as a young person?
So growing up, it was kind of private. I didn't go to my siblings' births, anything like that. And with my first son, we had a hospital birth, and it was, of course, very traumatic. And it was, especially the breastfeeding, that was probably the most traumatic part, was the breastfeeding. I had a nurse come in, and I was feeding my baby, and she's like, "You're not supposed to be feeding him. He's supposed to get a bath before my shift ends. And now he's going to puke because you just fed your baby." So of course I'm like, oh my gosh, what did I do wrong? All I did was feed him because he was hungry, and it was very traumatic. And after that, he kind of, I nursed him for 2 years, and we had a really close bond. So when we were gonna have our first daughter after him, we decided, okay, we don't want him in the hospital, and we want him to be a part of this experience. So that's when we searched, and we seen a local midwife of the Ashland Birth Center, which I apprentice at now. So I've had a long history with them it's been 7 years now, but I first learned. And once I got in their care, I'm like, oh my gosh, this is what I love, and I need to learn everything I can about this. So it was a few years ago, Doreen Day hosted Indigenous birth teachings, and I attended it. Penny Charette invited me to the teachings and brought me along because she knew my interest in it. And yeah, I learned my teachings through Doreen Day and Penny, and it's just been awesome. It just blossomed, and we have tribal members from other communities that are traveling to Ashland to receive the care, and it's just amazing to see how it's starting to, the ripple effect, how it starts in one place and it's just slowly spreading out to other communities. And that's what it's about. It's not just about, your community, it's about, Indigenous families as a whole, and making sure they receive that care. And I've also had people from the white community that have asked and wanted to receive Indigenous birth teachings incorporated into their care. And we've allowed it, of course, you know, as Native Americans, we're very opening. We don't believe in the, you know, you're not Native American, it's not in your blood, you know, because we always adopted people in their tribes. So it's not for us to say what they, you know, what their experience is like. So I've had been reached out by white community as well that just are fascinated by it and wanted to learn and incorporate some of it, which we were open to. And yeah, we had a really positive response on it.
Thank you. So I am seeing a few questions. So we'll start with the Facebook questions, and then I do see some questions in the Q&A. So I've been trying to track those ones down because I can't see them right now. But so a question we have is you talked about the importance of father partners being involved. Can you provide some examples of ways partners can support breast/chest feeding so that they feel connected and valuable?
Yes. So what we have done was we really offer that time right after the first hour. We hand baby over to dad and say, okay, you know, can you take your shirt off, get skin to skin with baby, and really let them have their bonding after that first hour. Because then once the mom and or, you know, parents have their first hour, then we'll tend to the birthing parent and clean them up, get them comfy, get them all situated. And then during that time, that's dad's time to, you know, start the bonding. And I've seen a really positive like feedback with that, where after that, when they bond right away, the sooner they bonded, the better like the relationship was. In my own experience, with my babies, their dad ended up having to actually hold them before they would even calm down to nurse. So if they cry, I couldn't just put them on the boob and nurse them. Dad had to hold them and rock them and hold them close, and just that like strength and comfort, calm them down, and then they would nurse. So it's really just kind of getting them in the routine of it too, involving them. So in, you know, if it's initial, okay, we'll hold baby, you know, skin to skin, and then give them to the birthing or the mother to nurse.
Thank you. So our next question is, can you share the differences between the services that a doula offers versus a midwife?
Yes, so we love support of doulas. We have, as Indigenous people, we have like numerous doulas, whether it's mom, auntie, family, and then, you know, we also have doulas that we work with at the birth center. But they help out tremendously. You know, the midwife is really focusing on the safety of it. Doulas are really hands-on, you know, that physical support, emotional support. Midwives do offer that, but it's very limited because there's a lot of background stuff that they got to do, charting, vitals, really just making sure that like it's all, you know, running smoothly, and the safety of, you know, the birthing parent and the child. Whereas doulas have been, you know, really hands-on and just moral support for that birthing parent, which is why it's really important to have doulas as well. You know, that's why I include like just birth workers, because it's very broad, and we have numerous birth workers at births. You know, whether it's we have the father with tending to the fire, we have, you know, the grandpa helping, our uncles, and it's really just about like a community working together to bring that baby and make sure the birthing parent and baby are safe.
So our next question is, this is such great work. Can you talk about any emerging efforts or known practices to support two moms as opposed to a mom/dad in a family or in family support initiatives?
Yeah, so really I would, you know, no matter what the diversity of the family is, it's really just the same concept of the including them, you know, including everybody that's involved, you know. So the birthing parent gets their one-on-one time, and then having the next mom come in and, you know, bond, and really just giving them that space that is needed. You know, that's the biggest thing that I've seen is they're not offering that space, like, hey, come come on the bed and, snuggle up with your new baby and the birthing parent and really just bonding together. And then same for, whatever we offer, them to be involved in any part of the ceremonies, helping with anything. It's really crucial for the involvement, and it could be incorporated in any way, whether we have men that will come in, our designated birth keepers, and they will come and help out, or we're really open to teaching anybody about it and how they can do it, because it's all about how you feel, how your experience, and making sure that as long as you feel what you're doing is good, the intentions are good, everything works out great. So always, if something is wrong, speak up, because it's their experience. So speak up if you need to. Tell them, hey, I'm gonna do this. I want to be involved with this. I'm gonna do this, and really just making sure that what your needs are met in the experience.
Thank you. So just as a reminder to everyone that is attending right now, if you have a Q&A, please put it into the chat box, because I'm having a hard time opening up the Q&A section, but I do have it open for some of the questions. So I actually have some of my coworkers working in the background, like, here's what the questions are. So the next question is, can a breastfeeding ceremony be held after you have a baby or only while pregnant?
Definitely whenever. We do, for our care, we do a lot of coming to them, after. It's a lot of like, not just, okay, you're done, now you're out of care. We do 24-hour visits, 3 days a week, 2 weeks, and really just like, we've been on call for, questions, whatever. It's about supporting you through your new journey as, with the newborn. It's not just about the pregnancy and birth. It's about that continued support whenever. We haven't had a time limit on it, especially with, and when you become a community and you get the community support, there's no time frame.
Our next question is, let's see. How has your midwifery journey impacted your commitment to motherhood and home life? And how do you keep the two paths balanced?
So it's really been, they're really involved. They know the work that is done. It's been hard to balance as far as I have a 5-year-old turning 6 that wants to go to every birth. She wants to be, hands-on, helping, and kind of just reeling her back in and saying, no, you gotta wait, you're still little, you can learn when you're older. But otherwise, they really understand the importance of it, especially because it's what they grew up around, and they've all attended each other's births, and it's been a family commitment, and it really is. And part of that balance is making sure that your partner is good, making sure if they're home with the children all the time, and giving them a break, finding backup if they need it, so extra support. It's finding community support for your family as a whole, whether they're gonna bring a meal by to help out, dad or their partner. So it's also not only about yourself, but making sure your partner's health is taken care of as well.
Nice, thank you. So this is from Karen. This is more of a comment. In my mind's eye, I can see how amazing a birth this would be for all, the connection to each other and the life itself. I'm not Native. Both of my children were born at home in the quiet and calm of family space rather than hospital space. Thank you for sharing. I admire your work.
Miigwech. Thank you.
Yeah. This next one is from Jess. Jess says, hi, I'm an IBCLC and permaculture gardener / herbalist in Florida. And thank you for sharing about Native breastfeeding. I love the statement of breastfeeding / chest feeding as food sovereignty. This is an idea that all cultures can get behind. Can you discuss more about why food sovereignty is so important to you and to the Native breastfeeding community?
Yes, so not just food sovereignty, but right now we're really trying to focus on our sovereignty, you know, in anything. So we've made it like with the family as a whole. We brought in a food sovereignty team where we are gardening more. We're supporting our family off the land more, and really going back to our traditional ways with it. And part of that is the health benefits. You know, we are more prone to, you know, cancer, diabetes, and all these health issues that we never experienced before because of our traditional food that we ate. And, you know, the mother's nourishing baby or the breastfeeding parent, they always provided that nourishment. We didn't have to worry about what was in their food or anything like that. So that's really important when thinking about the long-term health of the community, is really trying to go back to our traditional ways to get the next 7 generations healthy.
Nice, thank you. Let's see. So one of the comments says, "I wish I lived close. I'd love to volunteer." That's beautiful. I guess that for me would, I would ask what or who or kind of how would you reach out to birth workers in your community? How would you go about to finding who those people are for people who are interested in volunteering with those circles?
So the first thing that I would do was reach out to like the tribal community. Sometimes they have in their clinic, if they have a clinic on there, they'll have like home visiting programs. I've seen a lot of home visiting programs that are caring for, you know, pregnant individuals already. They all have resources, and that's how kind of I got into it. It was a home visiting program I worked for, and then just reaching out and saying, "Hey, I would love to, you know, put me down as a volunteer." You know, the community itself will build a list of resources, and so getting yourself on that resource list and just letting it be known, like, I will volunteer for this, or I just took this training, or ask, are there any trainings that you're going to be hosting? Our clinic here hosted the Indigenous breastfeeding counselor training. So yeah, definitely just looking out and seeing if they are offering any trainings or in the future, or if they have a resource guide that you would like to be added to for the community.
Thank you. I am gonna offer up an opportunity to ask questions for a little bit longer. You can put those in the chat box. My question, I guess now, one of my, maybe my final questions at least, include kind of birthing work is really important to our communities, partly because it focuses on our communities as the center, as opposed to kind of like mainstream medicine, and how that really has supported our communities in some ways or not supported our communities in other ways. And so for me, this work is extremely just sacred and important. And so I'm really grateful to you for offering up some of this wisdom. That being said, my question is, how do you kind of have those conversations with providers or in the area about honoring like indigenous birthing work, or just midwifery at all?
So the biggest thing is we're all working for the same reason. We care for the overall well-being of the Indigenous people and the community. So putting it out there and saying, hey, this is really important, like, how can we work together to support the Indigenous community as a whole and their overall well-being? Because if you were to go to a clinic that's just for your prenatal care, they're not going to look at the barriers that you face. They're not going to think about, okay, what have they gone through to get to this appointment today, or how can you help with that? So it's making sure that all of them are on the same page, whether it's ICW, the Department of Justice, natural resources. It all ties together in our overall well-being as a person. And you can't just focus on one thing and expect it to get better. you have to focus on everything and fix it as a whole. And, and that's where our culture is. Like, we really just have to incorporate our culture into everything that we do. And yeah, just really just reaching out and seeing how you can support and collaborate this person and this community as a whole for their overall well-being.
Yeah, that's really important, because as we know, kind of the stronger our ties in the community, or sometimes the more that we have in the community for supporting those sacred youth and the sacred birthing people, just generates more of this collective love. Yeah. We have another question that is very important for this time right now. How has COVID impacted the birth work in these times?
So as a student midwife, we kind of pulled back on eliminating the necessary face-to-face, really offering, support over the phone, or we incorporated using outdoors more. We'll do prenatals outside or anything like that. We kind of transformed the outside of the birth center to, safety, like our screen, so it's more private, and then just furniture out there, and really incorporating the outdoors, which is better anyways. It kind of gets you out and enjoying the nice weather, but it has been stressful for families. We have had people transfer into care because of the scare of the hospital, and really just making sure that we're being safe and we're protecting the families, because it is about them, and they have every right to decline, or as eliminate some unnecessary services, and just offer the Zoom support or telehealth visits. But so far, so good.
I'm glad to hear that. We have another question/comment from Ursula. Ursula writes, I'm a labor nurse, Lakota, Kiowa, Saginaw, and work at the Mother Baby Center in Minneapolis. Increasing breastfeeding rates is my passion in our community, but I feel like I've often felt resistance from my Native patients. At the bedside, I work so hard at education with promoting breastfeeding, but when they leave, I feel they have little support outside in the community/city. What are some city resources that are available to get them connected?
That's a good question, because we're in a rural community here. Really, it's about finding that support in your community. Like, we have some grandmothers, like I'll say Penny, for instance. She was kind of our go-to support, where she would just volunteer to go and support this mother with any questions that they had. And it's hard, I don't know, it's hard to say for a city-wise, but if you can try to reach out the people that you would know that would be willing to volunteer for help. And it's really hard as a Native American to ask for help or to be open to it, especially if they don't have that support, because we do seek the support from our elders in our community and our family. So it is hard, especially if that's how somebody was raised, and it is hard to break, but it can be done with just persistence and building that trust in that relationship.
Yeah, and I can answer that question a little bit too outside of the webinar, because I do have some resources in Minneapolis specifically, and so I would love to kind of talk more about those, which you might already know, but yeah, let's connect. So I have another one here. It says, I've read that less than 1% of U.S. lactation consultants are Indigenous. We know that this is also an issue among other groups. We need more diversity in lactation and birth work. Representation matters. Are there organizations working to train more Indigenous lactation consultants through training and outreach?
I only know I did the Indigenous breastfeeding counselor training, and they are willing to travel wherever. These women are amazing. Cami Goldhammer, she is in charge of that. So really, I would look into seeing if maybe they can come to your community and just get a group of women that, or people that would like to be involved in that. That's how it happened in my community. We just reached out with the need of it and opened it to anybody who would be willing to.
And I know we have a few more, so I'm just kind of waiting on those. Yeah. I guess in the meantime, I can mention that ACAF and Hope are going to be hosting a meeting toward the end of the month on Tuesday, August 25th, I believe, at the same time. This one is actually going to be a meeting instead of a webinar, and so that'll give us more opportunity to have a dialogue around Indigenous birth work and breastfeeding, chest feeding. And so we would love for many of you to come to that. I think Hope and I had kind of discussed having the option to bring your little ones along and kind of just making them a part of this space, and
yes,
an opportunity to actually have some direct questions about breastfeeding, chest feeding. I do see one here, and I know I have some in the Q&A, so I'll start with the one I see in the chat. Lauren says, hi, I'm in Milwaukee at an urban Indian facility, and we have developed a breastfeeding support program. I would love to expand to include peer counselors / doula / midwife that can support birth and do home visits. Are there any groups that would suggest I connect with?
I don't know specifically, but as far as wanting to become a midwife, reaching out to any local midwives or organizations in the area for that. And I know one of the biggest things that they're trying to do is support Indigenous midwives. So they're looking for, they're more than likely going to accept a apprenticeship with a Native American or a person of color, and really supporting them through the journey. So reaching out to any local midwives saying, hey, I'm interested in becoming a midwife. Are you accepting any students now? If not now, I would be interested in the future, or, just getting it out there that you wanted to be a student and learn about it. And more than likely, they are going to say, heck yes, I will definitely help you. Just because of the lack of, the Indigenous and people of color.
Great. So I do have some of those questions from the Q&A box. As I'm starting to create a birth plan with my first child, I'm wondering how I would incorporate ceremonies with a midwife who doesn't know the ceremonies with my potential home birth.
So I would say if you can't find anybody in the community, maybe just looking outward and just seeking it, because it is something that you could just, do yourself or family. It's not, there's no right or wrong way when it comes to ceremony. I was taught that as long as what you're doing feels right, then it is right. So really just making sure that you feel good about, the care that you're receiving, or just saying, hey, can we smudge? Can we do this during it? And just letting it know that that's what you want there. And then if they can't find anybody, just kind of incorporate your birth team and them learning. And also, I know we can, on my website, I have different teachings that we do. I'm also open, of questions and what you would be interested in, and kind of talking you through it, how to add it to your birth plan.
I love that. Kind of like telehealth for Indigenous birth work.
Yes.
Yeah. The next comment is, my husband is disabled and would not be able to start a fire and such things. Are there Indigenous midwives or doulas in the Twin Cities that would know more of my goals for my birth plan? Yeah, so I guess if you are okay, Hope, I can kind of answer that because I'm in Minneapolis. Okay.
Yes.
Yeah, so we have a few opportunities here in Minneapolis to connect to some Indigenous midwives and doulas, and I would be more than happy to connect you to some of those resources if you want to reach out and email to me, and we'll give our contact information here at the end. The next question is, would the Indigenous breastfeeding trainers be able to do virtual trainings?
That's a good question. I do not know the answer to it. I am sure they would be open to that. Yeah, I don't know the answer. I don't know them specifically, besides myself taking the training, and at that time it was in person. But of course, we're all evolving around virtual now, and we're all learning how to cope with virtual learning.
Yeah, okay. So another question is, what would you tell Native women who are hesitant in breastfeeding? Maybe they haven't nursed their other kids, or maybe their views on breastfeeding is negative. So how would and could we reach those mothers?
So I was that mom. I wasn't breastfed. And of course, not only like the initial breastfeeding part, it's also very hard, but just knowing the importance. And not only that, like once you get started, it's the bond that keeps you breastfeeding. So then it becomes the emotional support in growth of your baby. And I've gotten a lot of negative feedback for like how long you breastfeed. Oh, well, they're over 1, you should stop. But you'll know how you feel about it. It's about the connection and about the bond. And it definitely does grow as the longer you nurse and you see the need that your baby and that your toddler needs for it, and just supporting their overall growth.
Okay. So this is a follow-up question from the virtual training question. Would you be able to do the training? Someone is interested here in Red Cliff.
So I do not do trainings yet. I am open to having discussions and on teachings that I know or how to support them. So I definitely would be interested in hosting, virtually that way. But I do not I don't have the credentials for doing a training and saying, okay, you're a counselor, but just to know, I am absolutely more than willing to share with my knowledge with anyone.
Yeah, that's one of the reasons why we're so grateful to offer this opportunity here, is because there's so much insight from you that I've learned and have learned in our very brief chats in some ways. And I'm so thankful to you. I do see that someone is raising their hand to talk. So we're going to try and see if this works for maybe one last question. All right. So So you should be allowed to talk now. And if you have a question, feel free to ask. We'll wait a little bit. To all of the people in the audience, I have really appreciated all of the questions that you've asked. I'm sure Hope does too. They've been just a broad range of questions and very insightful to getting connected to many resources, and then also just how to support our relatives. Yeah, I asked to unmute. I'm not sure if that worked. Thank you. Yes, I am trying to get my side to unmute as well. And we do have another question, and so my coworker is going to type that up. In the meantime, I will try and get that work out. Thank you all for your patience. So in the meantime, we'll try and get that question. I have one here. So COVID has truly reaffirmed the necessity for birth outside of hospitals and the understanding and use of our traditional medicine. That is very true. Do you want to offer some more insight on that?
So I do like outreach to we have a traditional healer that comes to our community kind of on a regular. So I have them see him for that. But one thing that we do for sure is cedar tea. It's really good for cleansing and, respiratory stuff too. So definitely making sure that you can drink, cedar tea, and we do a lot of prayer, making sure that you use in prayer. But I don't offer much more than outside of the birth, besides the teas and really for your health, like, and ginger packs, fresh grated ginger. That's for supporting your perineum during the birth, and that could all be prepared prior to your birth, and just freeze it. But yeah, I do a lot of outreach for that. That's on my next list to do.
Yes, a very long list as we continue to find ways to reclaim some of the traditional teachings and practices. I'm just so grateful for all of the work that you do. I always feel very inspired and just energized. So thank you for your work here. I am going to just try and share my screen. Oh, I do see one more comment. Yes, I will offer Hope's contact information for now, and then maybe we can get that question in towards the end here. So I'm hoping you guys, this is not we'll stop that one. I have a few screens open here. Can't keep them straight. All right, so here is Hope's contact information. I can send this out to all participants, and you can find her email here as well. Yeah, and I don't know if you have any other information on the contact how to contact you.
The website is www.indigenousbirthservices.com. So it's just like the email, which would be easy to remember. But there it kind of goes over everything. So you can kind of get an overview on like stuff that you might want to incorporate with your birth or whatever. And kind of just maybe if you get some more questions going, and then getting it ready for our meeting at the end of the month. And yeah, that's a place to start. Otherwise, yes, I am available. It has all my my phone, email on the website as well.
Great. I was worried I was muted, but I'm not. Okay, so yes, I do have one last comment from someone. As an Indigenous midwife and certified nurse midwife from Michigan, it is imperative to know your traditional healers in your area.
Yes.
So thank you for that. I think we both definitely agree with that. And I know here at ACAF we have tried or are trying to find more traditional healers and have it kind of set up throughout the country. Not set up, but have those resources, or just know some of the people in the area, so that if you're interested in finding those healers, that you can get connected to them. But yeah, Hope here has many contacts, I'm sure, for some of the traditional healers in the area for where she is. I know I have some here in the Minneapolis area, and we have many coworkers and contacts all over, so we would be happy to figure out ways to connect you if you're looking for that. Well, this is how you can contact ACAF here if you're interested in finding some of those resources that we talked about, or just have any follow-up questions about registering for this next webinar. We would be more than happy to answer those questions. As I said earlier, we have a meeting on Tuesday, August 25th at 12 p.m. And that is going to be a meeting about advocacy for families during the childbirth years. I think that's the title. Is that right?
Childbearing years.
Childbearing years, yes, childbearing years. And so we are very excited again to offer that up as an opportunity for community members to have more question time with Hope and myself. Yeah, so we would love to see you in that meeting. Yeah, so if you guys have any questions, again, just feel free to reach out to myself or Hope, and we will love to stay in touch. This is being recorded now, so it will be available online. So thank you all for your time today. Thank you so much, Miigwech Hope, for everything you shared. We are very grateful. Have a good day, everyone.